All right, so today we are going deep into neonatal emergencies.
Buckle up.
Yeah, those critical situations where every second counts, and we're going to be looking at it all through the eyes of
The
paramedics.
first one's on the scene.
Exactly. The first one's on the scene when a baby's life is on the line.
Right.
So to guide our deep dive today, we've got a couple of sources.
Two key sources.
Yeah.
Yeah, so first off, we're going to be referencing a paramedic textbook
Okay.
to kind of understand the protocols and the procedures.
Makes sense.
But then we're also going to be looking at some real-world case studies.
Oh, nice.
Yeah, to see how these emergencies play out, when the rubber meets the road.
Yeah, I like it.
In the field.
So before we get into, the really heart-stopping scenarios,
Right.
let's just make sure we're all speaking the same language here.
Yeah.
So when we say neonate, we're talking about...
A newborn baby.
Okay,
Specifically from birth to 1 month old.
got it.
And what's so fascinating about neonates is that even though they're so tiny, their physiology is completely different from older children or adults.
So what might seem like a minor issue for us could be life-threatening for a neonate.
Exactly.
Wow.
Their bodies are still developing,
Right.
so they can regulate their temperature or fight off infections as effectively.
So even seemingly simple things can escalate quickly.
Yeah, quickly.
That's a good point.
Which makes the role of paramedics even more critical.
Yeah.
They have to assess the situation fast,
Yeah,
make the right call, even when the symptoms might not be obvious.
you've hit the nail on the head.
That's why I think these case studies are so valuable.
Yeah.
They illustrate not only the medical complexities, but the human element.
Oh, interesting.
The quick thinking,
Right.
the split-second decisions.
I'm ready for some real-life drama.
Okay, all right.
Hit me with it. What's our first case study?
It's called the cyanosis puzzle.
Ooh, okay.
And it starts with a frantic grandmother calling 911. Her 6-month-old grandson is having trouble breathing and has turned blue.
Wow, that's got to be every parent's worst nightmare.
It is.
What goes through a paramedic's mind when they get a call like that?
Well, first you have to remember that cyanosis,
Right.
that bluish discoloration of the skin,
Yeah.
it's a major red flag in infants.
Okay.
Typically means there's not enough oxygen in the blood.
Okay.
So the paramedics rush to the scene,
Yeah.
and they see this baby who's conscious but clearly distressed.
Oh, man.
So what do they do first?
What do they do first? Yeah.
Well, the textbook emphasizes the ABCs:
Okay.
airway, breathing, and circulation.
Got it.
So they check the baby's airway, make sure it's clear,
Okay.
and then they assess his breathing.
Okay.
They find that he's breathing rapidly but with difficulty.
Oh, okay.
They also feel for a pulse and find that his brachial pulse is strong.
Okay. So that's a good sign, right?
Yeah.
A strong pulse means his heart's still beating effectively.
It is a good sign. It's just one piece of the puzzle, though.
Okay.
The paramedics also find signs of a possible ear infection
Okay.
and learn that this breathing difficulty came on very suddenly.
You mentioned the puzzle earlier, and I'm guessing these are all clues
They are?
that help the paramedics kind of figure out what's going on.
Absolutely.
Right.
We're like detectives,
Right.
piecing together the
I
evidence.
like it.
And in this case, the sudden onset of the breathing problems combined with the cyanosis.
Yeah.
That's a major concern.
Okay.
So they take the baby's vital signs,
Okay.
and things get even more concerning.
Oh.
His pulse is racing at 130 beats per minute.
Wow.
His respirations are 50 breaths per minute.
That's a lot.
His blood pressure is 80/60,
Oh, wow.
and his oxygen saturation is down to 88%.
Those are some scary numbers. It sounds like his body is really struggling to get enough oxygen.
You're right.
So what do they do?
So their immediate action is to administer oxygen
Okay.
via a non-rebreather mask. This is standard procedure to try to get those oxygen levels back up.
Right, but they still need to figure out the underlying cause.
Exactly.
Yeah.
And based on the symptoms and the rapid onset,
Yeah.
they suspect a congenital heart defect called tetralogy of Fallot.
Tetralogy of Fallot. Now, why does that diagnosis come to mind?
Well, it's because tetralogy of Fallot prevents enough oxygen-rich blood from circulating throughout the body,
Right.
which can lead to these sudden episodes of cyanosis
Oh, wow.
and difficulty breathing.
It all connects.
Yes.
But that's a serious condition. What can paramedics do in a situation like that?
Well, in the field, their main focus is to stabilize the baby's breathing and oxygen levels.
Right.
But they know they need to get this baby to a hospital and fast.
Yeah.
This is where rapid transport becomes absolutely crucial.
Yeah, because he needs specialized care from a pediatric cardiologist.
Exactly.
That's beyond what paramedics can handle on scene.
Exactly. And this case really highlights the importance of recognizing those subtle clues The sudden onset, the cyanosis, the vital signs, all of that,
Yep.
that might point to a more serious underlying condition.
It's not always as simple as it seems.
No, it's not.
It's a great takeaway for our listeners.
Yeah,
Sometimes what looks like a simple breathing problem could be a sign of something much more complex.
absolutely.
Right.
It's all about connecting the dots and knowing when to call for backup.
And speaking of backup,
Oh, yes.
let's move on to our next case where the backup arrives a little too late.
A little too late.
Oh, I'm intrigued.
This case is called premature arrival.
Yep.
It involves a 32-year-old woman who goes into labor 8 weeks early.
8 weeks? Oh my gosh.
Now, you know, premature births always present a higher level of risk.
Of course, because the baby's organs might not be fully developed.
Exactly. And in this case, it's the woman's first successful pregnancy
Oh, wow.
after a history of miscarriages.
So the stakes are incredibly high.
They are.
What happens when the paramedics arrive?
Well, they find the mother conscious and alert, which is good. But she's having contractions,
Okay.
there's bleeding,
Uh-oh.
and the baby is already visible.
So it's a precipitous labor.
You got it.
Things are moving very quickly.
Very quickly.
What are the top priorities when dealing with a premature baby?
Well, the first priority is always the airway.
Okay.
Premature infants often have difficulty taking those first breaths.
Right.
So the paramedics need to assess the airway immediately.
So they're checking to see if the baby's airway's clear.
Yeah,
And if they need help breathing.
exactly.
Okay.
And because this baby was born so early, they also have to be on the lookout for meconium.
Meconium, that's the baby's first stool, right? Why is
Yeah.
that a concern?
Well, if the baby inhales meconium during labor or delivery,
Okay.
it can cause serious respiratory problems.
Oh, no.
It can block their tiny airways,
Wow.
irritate their lungs.
So suctioning is key in those situations.
Quick suctioning by paramedics
Yeah.
can often prevent life-threatening complications.
I never realized how many things paramedics have to consider in these situations.
It's a lot.
Yeah.
And we're just scratching the surface.
Really?
In addition to the airway, they also have to think about the baby's temperature.
Oh, right, because premature babies can lose heat very quickly.
Exactly. They call it cold stress.
Right.
And it can be really dangerous for a newborn.
What happened?
It can lead to low blood sugar, make them more susceptible to infections.
So the paramedics have to work quickly.
Quickly.
Dry the baby off, wrap them in warm blankets.
Yes.
Just to make sure they're protected from the cold.
During transport.
It's amazing how even small details, like temperature control, can make such a big difference.
Huge difference.
This case really highlights the unique challenges of prematurity
It does.
and the specialized care that these babies need.
Absolutely.
So we've got a baby struggling to breathe because of a heart defect.
Right.
We've got a premature baby facing multiple challenges.
Yes.
What other kinds of emergencies might paramedics encounter?
Well, sometimes they get called to scenes where there's not much they can do.
Uh-oh. I have a feeling this next one's going to be a tough one.
It is. This one's called the silent emergency.
Oh, what?
And it's every parent's worst nightmare.
Oh, gosh.
Imagine you wake up one morning and your 1-month-old baby is unresponsive and not breathing.
Oh, my goodness.
Just a horrific thought.
So what happens when the paramedics arrive in a situation like that?
Well, they find the baby unconscious, not breathing at all, no pulse.
Gosh.
It's a full-blown cardiac arrest.
So it's a life or death situation, and every second counts.
Every second counts.
Yeah.
They immediately start CPR,
Okay.
trying to get that heart beating again.
Right.
And while they're doing CPR, they're also looking for any clues that might explain what happened, checking for signs of trauma, infection,
Yeah.
anything out of the ordinary.
But in this case, they don't find any obvious explanations.
No.
And that's when the possibility of SIDs comes into play.
Sudden infant death syndrome.
SIDS, I've heard of it. I don't really understand what it is.
So SITs is the sudden and unexplained death
Right.
of an infant under 1 year old.
Wow.
It's the leading cause of death in this age group.
Oh, my gosh.
It's one of the most devastating things a family can go through.
So basically, a seemingly healthy baby just dies in their sleep.
Yes, and despite decades of research,
Right.
we still don't fully understand what causes it.
There's a lot we don't know.
There is.
So if we don't know what causes it, how can we prevent it?
That's the million-dollar question.
Yeah.
And while we can't eliminate the risk entirely,
Right.
there are things parents and caregivers can do to reduce the risks significantly.
Okay. Like what?
So the most important is to follow safe sleep practices.
Okay.
Things like placing the baby on their back to sleep
Okay.
on a firm surface
Okay.
without any loose bedding or toys in the crib.
Got it.
Avoiding smoking around the baby is also critical,
Right.
as is making sure the baby doesn't overheat.
So simple steps can make a big difference.
Big difference.
But even with those precautions,
Yeah.
it sounds like SDIs is still a very real and scary possibility.
It is, but there's good news.
Okay.
Paramedics are highly trained to respond quickly and do everything possible
Yeah.
to try to revive an infant in these situations.
It must be incredibly tough for them to deal with these cases, both emotionally and medically.
Definitely is.
And that brings us to another important point.
Yes.
The emotional toll of neonatal emergencies.
Absolutely.
Yeah, we haven't really talked about that yet.
No.
These aren't just medical events.
No.
They're deeply personal and emotionally charged experiences
Absolutely.
for everyone involved.
For everyone.
Can you imagine being the parent who finds their baby unresponsive?
It's just heartbreaking.
Or the paramedic who has to deliver the devastating news that the baby couldn't be saved?
I can't even imagine.
That must be incredibly difficult.
It is.
And that's why it's so important for paramedics to be able to provide support and empathy.
Absolutely.
You, the families involved, they need to communicate clearly,
Clearly.
compassionately, answer questions honestly,
Honestly.
and be sensitive to the emotional state of everyone involved.
Everyone.
It's about recognizing the human element in all of this.
Human element.
And sometimes just being there, listening,
Yes.
offering a kind word can make a world of difference.
Difference.
Well, we've covered a lot of ground in this first part of our deep dive.
We have.
We've seen how paramedics use their knowledge,
Yes.
skills,
Absolutely.
and compassion to tackle some of the most challenging emergencies imaginable.
Absolutely.
So we just finished talking about some really intense situations.
Really intense.
And I have to say, it's starting to make me realize just how much pressure paramedics are under
A lot of pressure.
when they respond to these neonatal emergencies.
They have to be ready for anything.
It's true. So let's circle back for a second.
Yeah.
To something you mentioned earlier, FSIDO,
Right.
sudden infant death syndrome.
It's a tough one.
It's such a heartbreaking topic, but it's also something that I think a lot of parents and caregivers worry about.
Absolutely. And I think it's worth emphasizing those safe sleep practices again,
Yeah.
because they really can make a difference.
I agree. It's easy to forget about the little things, but those little things can have a big impact when it comes to infant safety. So just to recap, what are the key things parents should keep in mind?
Well, first and foremost, always place the baby on their back to sleep.
Okay.
That's the safest position for them.
Back to sleep.
Back to sleep.
Got it.
And make sure their sleep surface is firm.
Okay.
No soft mattresses, pillows, or blankets.
Right. They can create a suffocation hazard.
Exactly.
And what about toys in the crib?
It's best to avoid them altogether.
Okay.
They're not necessary for sleep.
Right.
And they can also pose a risk of suffocation or entanglement.
So back to sleep, firm surface, no toys. What else?
Make sure the baby doesn't overheat.
Okay.
Keep the room at a comfortable temperature and dress them in light, breathable clothing.
Okay. You don't want them to get too bundled up.
Right. And of course, smoking around the baby is a big no-no.
Absolutely. Secondhand smoke is a major risk factor for size.
Right.
And it can also cause a whole host of other respiratory problems.
So parents and caregivers listening, those safe sleep practices are essential.
Essential.
Every little bit of prevention counts.
Absolutely.
Okay, now moving beyond size,
Yeah.
let's dive back into some of the other key themes that emerge
Yes.
from those case studies and the paramedic textbook.
Okay.
So what are the most important things our listeners should remember about neonatal emergencies?
Well, I think the case studies really highlighted the importance of rapid assessment.
Okay.
Paramedics need to be able to quickly evaluate the situation,
Right.
determine the severity of the infant's condition.
So they're looking for those telltale signs. Like
Yes.
difficulty breathing, changes in skin color, or lethargy.
Exact.
That might indicate a serious problem.
Yeah, and then based on their assessment.
They need to initiate the appropriate interventions.
Right.
Sometimes that means administering oxygen,
Oh.
starting an IV,
Yeah.
or even performing CPR.
Right. It's all about taking those life-saving actions in those critical moments.
It is.
And another recurring theme was the importance of clear communication,
Oh, absolutely.
both within the EMS team and with the family members.
It's critical.
Why is communication so crucial in these situations?
Well, imagine the chaos of a neonatal emergency.
Right.
You've got Paramedics, firefighters, maybe even police officers on scene.
Yeah,
Everyone's trying to do their job.
of course.
Clear communication ensures that everyone is on the same page
Right.
and that the baby is getting the best possible care.
Right. You don't want any miscommunication or confusion
No.
when you're dealing with a life or death situation.
Exactly. And then there's the communication with the family.
Right.
Those parents or caregivers are going through an incredibly stressful experience.
Of course.
They need someone to explain what's happening, answer their questions honestly
Yeah.
and compassionately.
It's about providing reassurance and support during a very difficult time.
It is.
And sometimes that emotional support can be just as important as the medical interventions.
Absolutely.
So is there anything in the paramedic textbook
Yes.
that surprised you or that you found particularly interesting?
Well, there's a whole section on meconium that I found fascinating.
Meconium. Okay, let's unpack that.
Okay.
Um, I remember you mentioned it's the baby's first stool and that it can cause problems if it's inhaled during birth.
Right. And what's interesting is that the textbook actually outlines a very specific protocol
Oh, wow.
for meconium aspiration.
Okay.
The first step is suctioning.
Okay.
If they see meconium in the baby's mouth or nose,
Yeah.
they'll use a bulb syringe or a suction catheter to clear it out.
Right. Get rid of it before the baby can inhale it.
Exactly. But here's the tricky part.
Okay.
They have to do this before stimulating the baby to breathe.
Oh, so they don't want the baby to gasp and inhale it.
Exactly. Because if they stimulate the baby first,
Yeah.
the baby might gasp
Right.
and inhale the meconium deeper into their lungs.
Oh, wow. So it's a balance
The balance.
between clearing the airway and avoiding further aspiration.
You got it. And if the meconium aspiration is severe,
Yeah.
the baby might need more advanced respiratory support,
Like what?
like intubation
Okay.
and mechanical ventilation.
Wow.
Yeah.
I'm starting to see why paramedics need such specialized training.
Yes, they're dealing with some pretty complex procedures.
It's a lot.
And another thing that stood out to me in the textbook was the emphasis on temperature control.
Okay.
We talked about cold stress earlier,
Yeah.
but it's such a critical issue for newborns, especially premature infants.
I can imagine their little bodies are so vulnerable to those temperature changes.
Exactly. And the textbook explains that when a baby gets too cold,
Yeah.
their metabolic rate increases.
Oh, wow.
And they start to burn through their energy stores very quickly.
So it's not just about being uncomfortable. It's about their body working overtime to stay warm.
Precisely. And that can lead to hypoglycemia,
Okay.
which is low blood sugar, which
Right.
can be dangerous for the brain.
Wow.
And it also weakens their immune system,
Okay.
making them more susceptible to infections.
Gosh. So what steps can paramedics take to prevent cold stress in these emergencies?
The key is to keep the baby warm and dry.
Okay.
They'll
Yeah.
immediately dry the baby off after birth
Okay.
and wrap them in warm blankets.
Yeah.
They might also use a radiant warmer,
Okay.
which is a special device that provides heat from above.
I see. And I imagine they have to be careful about the temperature in the ambulance during transport.
Absolutely. Maintaining a warm environment throughout that transport process is crucial. They'll
Oh.
adjust the temperature in the ambulance,
Right.
make sure the baby's well protected from drafts.
It's amazing how much goes into caring for a newborn in these situations.
It is.
It's not just about treating the medical condition.
Sure.
It's about creating a supportive and nurturing environment.
Absolutely. And that brings us to another important aspect of neonatal care that's often overlooked.
Okay.
The emotional side of things.
Yes, we touched on this earlier,
We did.
but I think it deserves a little more attention.
Absolutely.
These emergencies are not just medical events.
No,
They're incredibly emotional experiences for everyone involved.
for everyone.
Imagine being a parent who has just witnessed their newborn go into cardiac arrest,
I know.
or a paramedic who has to deliver devastating news to a grieving family.
It's so difficult.
These are not easy situations to deal with.
They are not.
So how does the paramedic textbook address this emotional aspect?
Well, it emphasizes the importance of providing support and empathy
Okay,
to the families involved.
right.
It reminds paramedics to communicate clearly and compassionately, answer questions honestly,
Yeah.
and be sensitive to the emotional state of the parents and caregivers.
Right, so it's about recognizing that these families are going through this unimaginable ordeal
Yeah.
and providing them with a sense of understanding and support, even in the midst of all this chaos and uncertainty.
It is.
And this aspect of care, it goes beyond just the immediate emergency,
It does.
right? It extends to the follow-up care
Yes,
and the long-term emotional well-being of the families.
absolutely.
It's a lot to consider.
It is.
Well, I think we've covered a lot of ground in this second part of our deep dive.
We've gone from the nitty-gritty of meconium aspiration.
It's pretty nitty-gritty
It is.
to the importance of emotional support.
Yes.
We've really gotten a sense of the complexities and challenges of neonatal emergencies. So what awaits us in this final part of our deep dive? We've spent the last two parts really exploring these neonatal emergencies.
Fascinating stuff.
It is. And I have to say, it's really given me a whole new appreciation for the work that paramedics do.
They're truly remarkable.
They are dealing with some of the most vulnerable patients imaginable.
Absolutely.
And, it's not just about having the medical knowledge and skills. It's also about having the compassion
The empathy.
to support the families that are going through these incredibly stressful experiences.
Yeah, you've hit the nail on the head.
So as we wrap up this deep dive, let's distill everything we've learned
Okay.
into some key takeaways for our listeners.
Right.
What are the most important things that they should remember about neonatal emergencies?
Well, I think the first takeaway is that newborns are not just tiny adults.
Okay.
They have unique physiological needs
Right?
and vulnerabilities
Right.
that demand a specialized approach to care.
Right. Their airways are smaller, their immune systems are still developing,
Right.
and they're much more sensitive to temperature changes.
Absolutely. And that understanding should inform everything from how we handle them to how we assess and treat them
Right.
in these emergency situations.
So takeaway number one, respect the unique physiology of newborns.
Absolutely.
What else should our listeners keep in mind?
Takeaway number 2, be prepared.
Okay.
Neonatal emergencies can happen anywhere,
Right.
anytime. So it's essential to have some basic knowledge and skills.
Like knowing infant CPR and understanding safe sleep practices.
Exactly. Those are simple things that anyone can learn,
Right.
and they can make a world of difference in those critical moments before professional help arrives.
So know the basics and be ready to act.
Yes.
That's great advice.
What else?
What else? What?
Takeaway number 3,
Okay.
don't hesitate to call for help.
Oh, that's a good one.
If you're ever unsure about an infant's well-being, trust your instincts and call 911.
Right. It's always better to err on the side of caution.
Absolutely. Paramedics are trained to assess the situation
Yeah.
and provide the appropriate level of care, even if it turns out to be a false alarm.
I like it. And finally, takeaway number 4.
Remember the human element.
Yes. These emergencies are not just medical events.
Uh,
They're deeply personal and emotionally charged experiences for the families involved.
for everyone involved.
So it's important to approach these situations with compassion,
Empathy.
understanding. I think those takeaways really capture the essence of what we've explored in this deep dive.
We've gained a deeper understanding of the challenges and rewards of responding to neonatal emergencies.
And hopefully,
Hopefully,
we've equipped our listeners with some valuable knowledge and insights
tools for their toolbox.
that they can carry with them.
Absolutely.
So as we conclude this episode, I want to leave our listeners with a final thought-provoking question.
Okay.
Knowing what you know now about the fragility of newborns and the complexities of these neonatal emergencies,
Yeah.
what steps can you take to be a more informed and proactive advocate for infant safety in your own community?
It's a great question. Perhaps it's taking an infant CPR class,
Oh, yeah.
volunteering at a local hospital's neonatal unit,
Right.
or simply spreading awareness about safe sleep practices.
Yeah.
Every action, no matter how small,
Right.
can contribute to a safer
Absolutely.
and healthier environment
Well said.
for these little ones.
Thank you for joining us on this deep dive into the world of neonatal emergencies.
It's been a pleasure.
We hope you found it informative
Empowering.
and empowering. Until next time, stay curious, stay informed,
Compassionate.
and stay compassionate.